Hey guys, how's it going? I'm Dr. Victoria Munoz, and this month we're going to do a series on regenerative therapies. I wanted to come to you and give you some more specific information about the type of treatments that you can expect to get from your regenerative medicine specialist. So we're going to cover prolotherapy, PRP, and stem cell, also known as allograft, in the weeks to come. Today I'm going to talk about prolotherapy, and I think it's important that you're informed and that you can make solid, qualified health care decisions when it comes to your health. Last month we talked about conventional medicine and back pain and what you can expect from your conventional medical doctor. Conventional medicine rarely, if ever, gets you better. Basically, what they do is they palliate or they recommend surgery, which is rarely, if ever, a solution to your problem. So today we're going to talk about prolotherapy and kind of what you can expect from a prolotherapy type treatment, and and determine if it's something that might be for you. If you're having back pain or joint pain, this is one therapy that is often used to help treat that. So what is prolotherapy? Well, prolotherapy, also known as proliferative therapy, is known as a non-surgical ligament and tendon reconstruction and regenerative joint injection, and it is recognized. It is a recognized orthopedic procedure that stimulates the body's healing process to strengthen and repair injured and painful joints and connective tissue. So it's based on the fact that when ligaments and tendons are stretched or torn, such as if you dislocate your shoulder, for example, or if you tear something in there, the joint they're holding destabilizes and can become very, very painful. So what prolotherapy does is, with its unique ability to directly address the cause of the instability, can repair the weakened site and produce new collagen tissue, resulting in a permanent stabilization of the joint. So once the joint is stabilized, pain usually resolves. The traditional approach with surgery has more risks and may fail to stabilize the joint and relieve pain. Anti-inflammatories and other pain relievers act only temporarily. The original term used for the therapy was sclerotherapy, and this was coined in 1930 when the treatment was discovered. This included both joint and vein injections. Well, today the term prolotherapy is used for joint, ligament, and tendon injections, whereas sclerotherapy is used for the treatment of varicose veins, spider veins, hemorrhoids, and other vascular anomalies. So you're probably wondering, how does prolotherapy work? Well, prolotherapy works by stimulating the body's natural healing mechanisms to lay down new tissue in the weakened area. So this is done by a very direct injection to the injured site. And basically what it does is it tricks the body to start repairing again. What happens is the tissue inside of joints and along the spine has very poor circulation, and it is very difficult for the immune system to reach these areas. So what happens is, once you have a tear, you sustain some kind of injury to that area, it rarely, if ever, repairs fully. So what we're doing is we're inducing a mild inflammatory response, which is created by the injection and encourages growth of new normal ligament and tendon fibers, resulting in a tightening of the weakened structure. Additional treatments repeat this process, allowing a gradual buildup of tissue to restore the original tissue to its original form and strength and tensile strength. So you're probably wondering, what is the solution that is used to inject this area? Well, prolo injections contain natural substances that stimulate the healing process, as well as a local anesthetic agent to help with the pain of the injection. Traditional formulas include ingredients such as dextrose, which is it's a high concentration sugar, medical grade sugar solution, saline, serapin, procaine, and lidocaine. In the last several years, newer formulas including PRP, which is platelet-rich plasma, and stem cell, are being used as well for regenerative treatments, and we are going to talk more about that in the next couple weeks. Each treating physician tailors the selection of the appropriate formula according to the patient's needs. So yeah, I use Prolo with PRP. I use PRP with allograft. I use a combination of these therapies, depending on what is best for my patient. And so it is very individualized for sure. So is the prolotherapy treatment painful? Well, any pain involving an injection will vary according to the structure and the joint being treated. So we also need to consider the solution being used and the skill of the administering physician. The treatment may result in a temporary increase in pain with mild swelling and stiffness. And again, like I said, what we're doing is we're we're inducing inflammation to induce healing, because these areas don't heal very well on their own. So we're tricking the body into healing by recruiting the immune system to those areas. So the discomfort usually passes fairly quickly. It can also be reduced with pain relievers such as Tylenol. Now, we don't want to take medications for the pain like ibuprofen and aspirin. We don't want to ice the area, because what these do is they suppress the immune system, and they would inhibit the inflammation that we're trying to induce to recruit the healing process. So can prolotherapy help everyone? Well, each patient must be evaluated thoroughly with a patient history, physical exam, and a radiological exam. And I usually send my patients for an MRI. If my patient doesn't have an MRI that's 6 months or newer, then I send them for a new MRI of the area, because typically what happens is with these areas that are injured, they continue to degenerate over time. They don't get better, and they don't just stay as they are. They actually get worse. So also when indicated, I'll do lab work and evaluate that prior to treatment. So with this information, I can evaluate your potential success with the therapy. Success depends on factors which include history of the damage to the patient's overall history and ability to heal, any underlying nutritional or other deficiencies that would impede the healing process. And yes, in appropriate patients, prolotherapy is highly, highly effective. So who administers prolotherapy? Well, it's a physician. Physician would be administering this treatment, and this physician is trained and receives training with the American Orthopedic Association of Prolotherapy Regenerative Medicine, or an equally authorized training group. It's very important that your physician is trained to do these treatments. Postgraduate training is a prerequisite before treating any patient with a medical orthopedic problem which might benefit from prolotherapy. So what areas of the body can be treated with prolotherapy? Well, any areas or problems treated include low back pain, mid back pain, including degenerative disc disease, sacroiliac joint instability or dysfunction, neck pain, knee meniscal tears, wrist or hand pain, osteoarthritis, shoulder pain, including rotator cuff tears, elbow pain, including golfers or tennis elbow, foot pain, including plantar fasciitis, ankle pain or instability, or hypermobility, osteitis pubis, IT band syndrome, piriformis syndrome, TMJ syndrome, and other musculoskeletal pain and injuries. So you kind of get the picture. Any musculoskeletal injury can be treated with this therapy. Some areas or problems can be more challenging than others, and it is therefore important to be evaluated by a physician trained and experienced in this procedure so that an accurate assessment and treatment can be given. So how often will you need these treatments? Well, typically it takes 3 to 6 treatments. It takes 3 treatments to get the patient out of pain. This is on an average, and 6 treatments to get the patient fully healed and back to their original, functional state. So, so the treatment intervals will vary depending on the specific problem, the severity of the area being treated, as well as the protocol of the physician. So, sometimes treatment may be more frequent, and sometimes it may take longer depending on the condition being treated. And so what is the rate of success in the treatment of prolotherapy? Well, the anticipated rate of success depends on a number of variables, including the patient's history and ability to heal, the type of solution that the physician is using. In patients with low back pain, for example, studies have shown that 85 to 95% of patients experience improvement with prolotherapy as compared to a 52% improvement with back surgery. So many studies done over the years show a high success rate with prolotherapy when it's used for various ligament, tendon, and joint pain and injuries. So how new is this therapy anyway? Well, prolotherapy, which was previously known as sclerotherapy, has been used successfully as early as 500 BC when the Roman soldiers would come with shoulder dislocations and tears, and they were treated with hot branding irons to help fuse the tendon, the torn ligaments back together in the shoulder. Advances in medicine, obviously, we're not doing that now. But advances in medicine greatly improved on this process, thank God, right? And lead to more modern techniques of strengthening the fibrous tissue and creating normal new collagen rather than producing a scarring and fusing of the tissue. Hippocrates described vein sclerotherapy as early as 400 BC. He would use these slender instruments of iron to treat varicose veins. Injection sclerotherapy of veins was first reported in 1623, and modern forms of injection sclerotherapy for varicose veins, hernias, hemorrhoids, and so forth have been used since as early as the 1900s. Earl Gedney, D.O., a well-known orthopedist, he was actually able to decrease his surgical practice and begin to inject with this solution in the 1940s and 50s, and he spent the rest of his life researching and publishing on the subject. Also, George Hackett, MD, wrote a book on this injection therapy with Gustav Hemwall, MD, adding to the publication in the 1950s. So, both Gedney and Hackett, their works are still used today in training physicians in these therapies. And in years since these early works, techniques and medications have advanced to move from a scarring or fusing effect to a strengthening regenerative effect to restore the weakened joint to its original level of stability without loss of flexibility or function. And advances in regenerative medicine have made the use of more advanced formulas such as PRP and stem cell for an even more enhanced healing effect. So again, it's going to be your doctor who determines what treatment is right for you. And like I said, we're going to talk about PRP and stem cell in upcoming videos this month. But hey, guys, that's a wrap. That's prolotherapy. If you want to schedule a free 15-minute consultation to learn more about prolotherapy and to find out if it's right for you, you can call the number in the description above. You can go to my website.